All right, we will go ahead and get our session started today. Thank you all who have been able to log in and are joining today's session. My name is Asia Simpson. I am the Wellness and Health Benefits Consultant for your district, Pomona Unified School District. And many of you have probably seen me before if you have attended any of the workshops that I've done in the past, either this year or last year, or if you've attended any of the open enrollment fairs that have been on site. Today's session, as it shows that on the slide that is displayed, is going to be covering HMO versus PPO. And this is extremely relevant for this week as the Health Benefits Open Enrollment Fair will be Thursday of this week. And you guys are currently in your open enrollment session. So the goal of today's workshop is really to help explain the differences between HMO versus PPO. Also, because you all have a number of different HMOs, we'll kind of cover a variety of different bits of information that will help you distinguish one HMO from the other. Today's session will be recorded, so we will go roughly somewhere in the neighborhood of about an hour, maybe less than that, just really depend upon your questions and how often we have to stop during today's session. So if you have to drop off for whatever reason, just know that you can view this recording at a later time. This will be sent out to the district office to be distributed to all employees. And it will also end up being posted on the benefits webpage. So no fear if you have to end up leaving early, or if you want to just watch this again, it will be available for you to watch. Without further ado, let's go ahead and get us started. I'm going to go ahead and share my screen really big so that we can all see the information. And let's make it big here. So I want to start off with just kind of going over. I started with a little bit ago talking a little bit about what we would cover, but I want to discuss a few more things. So the first and foremost piece of what I want to address is like, why is this workshop even important? Why is even understanding the difference between HMO versus PPO even important at all? I want to discuss that. I'll also be discussing some important terms that will be very um, relevant for you to know as you utilize your plan or have to navigate your plan for whatever reason. And we'll talk about comparing the differences between HMOs versus PPOs in terms of characteristics so that you can really define what that looks like for you and whether it's relevant for you to actually make the switch. We'll recap some of the differences. And then I'll share a little bit about how PPOs work because they are a little bit more complex than HMOs are. And oftentimes people get a bit confused about how they work. They sometimes don't really utilize them in the manner that is going to be most advantageous to them, and it ends up costing them more. And then we'll look at what the actual HMO and PPO options are that are available to you specifically as a Pomona Unified School District employee. And we'll talk briefly about what pharmacy benefit managers are. That pertains to like your scripts and how you utilize accessing your pharmacy benefits and your prescriptions. And then we'll answer any questions you might have. And if you have hung around to the end, we will do a little bit of testing your knowledge and get you qualified for a raffle. All right, let's go ahead and get started. And since we have, a bit of a smaller group today, if there's something that you need clarified, feel free to take yourself off mute and just give me a heads up and let me know. Okay, so first thing, hopping into it, HMO versus PPO. Why is this even important? Well, understanding the differences between the two can really affect, and it has a direct impact on how you see your providers, that is your primary care doctors, your specialists. It really affects how you see them and how easily you can see them. It also affects what providers you can see, very specifically, what facilities you can go to. And then it also affects what you end up having to pay out of your own pocket throughout the year for things such as deductibles, co-pays, co-insurance, out-of-pocket maximum. which coincidentally, we are going to talk about all of those terms as very important terms. So really affects how you use your plan and the freedom for which you have to use your plan. So important terms to know. I want to first start off because I use the acronyms all the time and I want to make sure you guys know what they mean. HMO is something that you hear very, very frequently. And what that stands for is Health Maintenance Organization. And essentially, it's a type of insurance plan design that limits the coverage to care to doctors and networks who are specifically contracted to your insurance plan. Okay. And so typically with an HMO, it won't cover out of network care except in the case of an emergency. So that limitation of coverage to care to doctors who contract or work within your network, that is a way for them to help limit the way or how far you can access in terms of network. It will limit how you can access doctors, facilities, um, uh, any type of doctors or facilities. Okay. Now, on the contrary, a PPO. PPO, first of all, stands for Preferred Provider Organization. And it is the type of design where you have more flexibility. You are not just limited to the coverage network that is within your health insurance plan. You actually do have the flexibility to see doctors who are, or go to facilities who are within your network of your health insurance plan. But if they're not, you can still see them. Now, it may cost you more money out of pocket than what it would cost you if you stayed with a facility or a doctor in network. And it could be the difference of paying and not paying, but you will not be denied. So you can see them in or out of network. And sometimes that is advantageous for some people. They prefer the flexibility of being able to do that. So these are the two different types of plans. This is what the acronyms actually mean. And just keep in the back of your mind that HMOs are quite a bit more rigid than PPOs, but for good reason, and they both serve their purpose. And for some people, they can serve their purpose at different points in their lives. So it may work out very well in some instances for people to either start out with an HMO or a PPO, and then as their family or financial or health situations change, they may need to consider switching over to one plan or the other. So hopefully in this workshop, I'll give you the basics of understanding what some of those things are to consider when you are determining which of these plan types are going to work out best for you. So before I get into the meat of the HMOs and the PPOs, I want to start off with terms that that are important or are relevant, whether or not we're talking about an HMO or a PPO. And so the first one that is highlighted in blue, it is deductible. And essentially, the deductible is the amount of money that you must pay out of pocket for covered medical expenses before your insurance company kicks in and starts helping with costs. A lot of times with HMOs, you don't really experience a deductible, but with PPOs, you certainly do. And a lot in instances where deductible may be relevant is there may be a service that is bigger cost than what you would pay if you went to just see your primary care doctor. Maybe it's thousands of dollars. And when you look at your insurance information, your coverage benefits, you see that there's a percentage, and we'll talk about that in a second, that you have to pay. And basically, the way that works is you would have to first cover your deductible, which is kind of like, a set amount that really is what you have to pay before your carrier steps up and say, okay, now we'll help. So the deductible is that set amount. And we'll look at what that looks like in terms of like a summary plan description. So copays are something that most people are familiar with. It's what you pay when you go to see your primary care doctor. Sometimes it's $15, $20, $30, $40. It really just depends on what your plan type is, how it's set up, which one you've selected. But these are for specific identified services like doctor's visits. It could be for lab work, or it could be for generic prescriptions. Copays are usually a smaller amount. And you will see copays with whether we're talking about an HMO or whether we're talking about a PPO. That's something that goes across plan types. Now, coinsurance, on the other hand, you typically won't see a coinsurance on an HMO. You will typically see a coinsurance on a PPO. Now, I am referring to plans that are available to you all as a Pomona Unified School District employee, and know that there are a lot of fancy different designs where they are not the basic setup as like an HMO versus a PPO that we talk about within the parameters of this workshop or this webinar, but the essential plans, HMOs and PPOs that you all have access to, you will see a coinsurance on a PPO plan. And essentially what a coinsurance is it is a cost that is expressed in a percentage that you have to pay for a particular type of benefit. For example, let's just say you have to have inpatient care, you have to have a service and you have to be inpatient. And the service that you have, say, costs $3,000. You will see on your summary plan description or in your plan information, if that type of service falls under that category, you'll see a coinsurance represented by, say, 20% or 10%. You won't see a flat number for a coinsurance like a $20, $40. What you'll see is a coinsurance. And sometimes what you'll hear is, oh, is your plan 80/20 or 90/10? And a lot of times people will get confused. And basically, the number that you want to focus on is the smaller number. And that is usually the coinsurance, which represents the amount you have to pay towards the cost of whatever that service is. So, in the example I just gave, if it was $2,000 and your plan says your coinsurance is 10%, then you would pay 10% of that $2,000. Now we're going to go over the details of an actual example so you can see how all of this plays out when we start discussing the way PPOs work. But in essence, the coinsurance represents the amount that you have, the percentage of the amount that you have to pay towards the cost of that service. And like I said, typically you will see that in a PPO. Out-of-pocket maximum. The out-of-pocket maximum is the amount of money, of your own money, that you will have to pay towards the cost of your medical care throughout the course of the year, and is typically for in-network services. So once you hit that amount in a given plan year, and you've paid out a certain amount, so let's just say your out-of-pocket maximum for your health plan that you've chosen is $4,000. If you've had an unfortunate year and had to spend a lot of money towards the cost of medical expenses, and you hit $4,000 by, say, May or June or whatever, then going forward, if it is in network and it is a service that is covered under your plan, you won't pay anything else. And we'll talk again about that in a little bit when we start to break out how the plans work. But these are the basic terms. Now, by no means are these the only terms, but these are the basic terms that are very important for you to understand, because they are ones that you will frequently hear referred to. If you were to call your insurance carrier, or if you were to look in your insurance documents, or if you were to go on to your insurance carrier's plan website, you would see these terms pretty frequently. And so if you have knowledge of these terms, it'll give you pretty strong footing to understand how to navigate one thing or another when it comes to costs with your medical plan. Okay, so speaking of costs, I do want to just throw this in here, not because it's irrelevant, but because I want people to understand the differences between what you pay out of pocket for your medical and what you pay out of paycheck, because a lot of times there is a little bit of misunderstanding when, especially when it comes to trying to determine which plan is a better option for you. Oftentimes people think that, especially if cost is a factor in terms of what you can afford, people think that the cheapest plan with the cheapest premium cost in terms of when open enrollment, when you look at the different plan options, whichever one has the smallest amount that is your deductible amount, or the amount that is deducted from your paycheck, you think, okay, that's the best plan. It could be, but not always. That's not always the case. So I want to first start by starting on the actual right side of the page where we're talking about what's in blue, out of paycheck. Out of paycheck is the premium amount, and that is the amount that you basically pay to have the plan. Okay. And that amount is deducted from your paycheck. And for however many over however many months throughout the year, I believe you all are tenthly, so it will be 10 months out of the year, you would have a premium taken out of your paycheck. And the amount of that premium is going to be dependent upon which plan you choose. Okay. So that is what I would say is out of paycheck. That is the premium. That is what you're paying just to have the plan. Now, you have expenses that are throughout the year, and depending on which plan you choose, your expenses can be less or they can be more. But that is what I would say is out of pocket, because these are expenses that you have to pay throughout the year towards the cost of your care. So that would be copays when you go see your doctor, you go see a specialist, deductibles. We just talked about that. That is the amount that you would need to pay towards the cost of services that require a coinsurance. And coinsurance, I mentioned before, is similar to copay, but it is actually a amount expressed in a percentage, and it is usually towards the cost of services that are a little bit more expensive. And then prescriptions. So all of these things are things that you're paying for all throughout the year, and so they are considered what I would say out of pocket. So those are going to vary based off of your health situation. They're going to vary based off of how many people are on your plan. They're going to vary based off of the plan type. But this out of paycheck is going to be the same for the full plan year that you're in based off of which plan you have chosen. Okay. So before actually I go into this, I just wanted to just do a quick check-in with you to make sure there were no questions on this slide or any of the previous slides that I just covered, to make sure everyone is clear and there's not been any misunderstood information. Okay, I don't see any questions in the chat box. Feel free to take yourself off mute if you do have a question, though. All right, so let's hop into the meat of what the differences are specifically between an HMO and a PPO. So an HMO, a health maintenance organization I mentioned before, is a bit more rigid. You are really limited to coverage within your plan network. And the first things first, before you can even go see any type of doctor within an HMO network, you have to designate your primary care physician. And your primary care physician acts as a gatekeeper, if you will. So you cannot just go and see a specialist at will, or because you feel like you have the need that you need to see a dermatologist, or you need to see a GI doctor. You cannot just simply make an appointment to see those doctors. Your primary care doctor has to make the assessment that the care to see those specialists is necessary, and then they have to put in a referral in order to see them. And then you can actually see them once the referral is actually made. And as I mentioned before, that with an HMO, you're limited to coverage that is in network. Now, of course, if you have an emergency, it's a true medical emergency, then they're by rights you are entitled to coverage at the nearest facility if it's a situation where your life is in danger. But the thing about the HMOs, the stringent gatekeeping around seeing specialists or other types of doctors, or receiving care that isn't provided from your primary care doctor, or being limited to coverage within your in-network, it does provide a lower cost to you out of paycheck, typically, in comparison to a PPO. So because of things being so limited, you generally don't pay as much as you would if you were to have a PPO. Now, with a PPO, you are not required to select a primary care doctor before you get to see a specialist. You have the freedom to, if you find that you would like to see a dermatologist, You can just reach out to the dermatologist that you are interested in seeing. Of course, you want to confirm that they're accepting patients and that they accept your insurance. But you can see whomever you want and make the appointment without having to wait for a referral through your primary care doctor. And you are not limited to providers or doctors or hospitals or facilities within your plan network. You can go to a doctor that, say, a friend of yours referred to you. And even if they're not in your network, you can still see them. Now, it does behoove you to stay in network with a PPO, because when you stay in network with a PPO, you tend to get a provider who is contracted with your particular insurance carrier, and they have essentially agreed to accept a certain rate for the services that they provide all patients who are in your plan. So what that can mean is lower costs for you for services. And when you go out of network, a couple things can happen is, you don't really know what that particular doctor or facility is going to charge for services that may be charged when you're in network. And so a lot of times that could be a little bit more expensive. And while you will have some coverage through your plan, it may not be at the same rate as what you would get is if you stayed in network. But again, you can see those doctors. And there's not necessarily a guarantee that there will be a price difference, but know that there is a high potential that could happen. And because of the flexibility of seeing whomever you want without having to worry about a referral, PPOs typically are a bit more expensive. So you pay for the flexibility. So just know that, okay? So they do serve as a great option, PPOs, for those who have a bit more knowledge about navigating health insurance. They can be a bit trickier for someone who is not as savvy. I'm not in any way saying that you shouldn't get a PPO if you're not savvy, but there are things that you will want to make sure that you know, because you will not be denied necessarily service or care, but you could end up paying out of pocket. So they won't tell you no. Whereas with an HMO, if it's not covered and you're going to have a cost, or there's going to be a cost of the plan, and it is outside the parameters of how your plan is set up, they'll just say no. Okay. So that is really the primary difference. You can have the freedom, but sometimes you have unexpected costs if you don't really understand how it works. So let's take a look at just a little recap of the differences, just side by side, okay? So you've got your PPO plans, which don't require a primary care doctor, I mentioned before, to be designated. You have direct access to specialists. You have out-of-network coverage, sometimes with an additional cost. You have a bit of a higher premium because you pay for the flexibility. You have a higher deductible, or essentially a deductible, period. Those do exist. And then you have co-payments and co-insurance with PPO plans. With an HMO, on the other hand, bit different, a lot more structured, a lot more tightly regulated. So you have to choose your primary care doctor first. You are only able to see specialists if your primary care doctor warrants it and gives you the referral. There is no coverage out of network unless in case of emergency. And because of this regulation, you tend to see lower premiums when compared to your PPO plan counterpart. Typically, there's not a deductible, at least in the plans that are available for Pomona Unified School District employees. So, you don't have to worry about that. And as a consequence, there's typically not a co-insurance either. So you will generally only see co-payments, okay? Co-payments are what you will typically see when you're in an HMO plan, okay? So that's the basics of the differences between those two. Any questions on that before I move on?
Yeah, I have a question about, let's see, the higher premium. So is there a percentage amount that typically, on average, it's a higher premium of 20%, or what is that on average, that percentage?
Good question. For the PPO plan option that is available for Pomona Unified School District, it is a what you call a 90-10 split. So that basically means that if you have a service that requires a coinsurance, 90% of the cost of whatever that service is going to be paid for by the plan after you pay your deductible, and then you'll pay your deductible, and then you'll pay the remaining 10%. So you would pay 10%, the plan would pay 90%.
And the deductible, what is that deductible amount?
Let me I can pull that information up. If you'll just give me we're going to get into the PPO piece of things. So if you want to hold on to that question, it actually may make more sense and put everything in perspective when we get to the PPO part of it. So,
Okay.
but just hang on to that question.
Okay.
Okay.
Thank you.
No problem.
Okay.
Alrighty, so let's go ahead and move on. And just as I was mentioning the PPO piece. So I'm going to explain how the PPOs work, and then I'm going to go ahead and answer your specific question about, because I do have the breakout of all of the plans in terms of the HMOs and then the PPOs, and I'll tell you what the specific one is for the Pomona Unified School District deductible for PPO. So let's start with first, like, how does this work? So this is an example. First and foremost, I want to say this is not a reflection of what your plan at Pomona Unified School District is in terms of the deductibles, coinsurance, and all that. This is simply for illustrative purposes, okay? But this will help you understand the plan that you have when we look at your specific numbers. So the first thing I want to explain about this is you have a coverage year period. Each plan that you have, the coverage period could be different. This example goes January 1 through December 31st because it's just a simpler way to think of it. For you specifically at Pomona, your coverage year begins October 1 of one year and goes to end of September the following year. Okay, so just for reference. But in this example, the coverage year is January 1st through December 31st. Okay, and in this particular example, this person's plan deductible is $1,500 and their split is 80-20. So the sample employee in this case would pay 20%, and then the sample insurance company would pay 80% after they've paid that $1,500 deductible. And then the out-of-pocket maximum is $5,000. Okay, so first things first. So deductible must be met before your insurance plan will pay the copay. So when I said this is a 80-20 split, what that means is if you have a type of service, you go into a hospital and the service costs a larger ticket amount. If it is like, say, in an example of $3,000, before the 80-20 split will come into play, your insurance carrier says, well, before we will pay our 80%, you've got to put some skin in the game. You got to pay $1,500 first towards the cost of your services. Now, it doesn't have to be all in one setting, like all in one service. It could be over the course of the year and a multiple different services, but it has to add up to $1,500 first before we'll kick in and pay 80% of it. So let's just say you are, let's start with the example here. Let's just say we're in the beginning of the year and you haven't reached your $1,500 deductible. And so you go into the doctor's office, the office visit is $125, you pay $125, your plan pays $0, okay? So unfortunately, you have a year where you have a lot of health expenses and your expenses add up. You have lots of specialist visit, inpatient care, all kinds of stuff. Then you get to the point where you have reached, and all of your doctor's visits and hospital stays or whatnot, your out-of-pockets have already reached $1,500. They haven't been major ones, but maybe they've reached $1,500. So you finally have a situation where you have to have a service where it costs, let's just say this particular service costs $75. Well, by this point, you've already paid $1,500 towards your deductible, and your deductible is $1,500. Now your insurance plan says, okay, you've put skin in the game, paid your $1,500. So now we're going to pay our 80 and you pay your 20. So your 20% in this example is $15, and the plan will pay the remaining $60. So now your 80-20 split is kicking in because you have already paid your deductible. Now, it could be a situation where it's not this specific scenario. Let's just say you have one big visit. Let's just say the visit is $3,000. If you had a visit where it was $3,000, let's just say it wasn't a bunch of mini services and visits, then if it was $3,000, then you would have to first pay of that $3,000, you'd have to pay your deductible, which in this example, it's $1,500. So you'd have to pay $1,500. And then what would happen is for the remaining $1,500, your health plan would pay the 80% of the remaining $1,500 and you would pay 20% of that. Okay. Now, I want to make sure that I'm clear. Your deductible is a one-time amount in the sense that you don't have to keep paying the deductible over and over and over again every time you have a service that is a larger ticket amount. Once you have paid the $1,500 in your plan year, going forward, for all of the services that require coinsurance, it will now work at 80-20 split in this case, okay? So if your plan is a 90-10 split, it'll be 90-10. But in this case, if you have services beyond having had that service where you've already paid your deductible, everything will be 80-20. So they'll pay 80, you'll pay 20%. So if we move on in this example, you'll see, let's just say that you continue to have an unfortunate year where you have to continue to shell out money for hospital expenses. And let's say it's so unfortunate that you hit $5,000 out of pocket. Well, we can see up here up top in this example that the out-of-pocket limit is $5,000. Once you hit $5,000, your plan actually pays the full cost. We're not talking about an 80-20 split once you hit out-of-pocket limit. Once you hit out-of-pocket limit, they're paying 100% of the cost of the services for the rest of that plan year, so long as it's in network. That is the tricky part you need to remember. In network, because when you go out of network, all bets are off. And so while you have the flexibility to see doctors in and out of network, just know that that does not apply to out-of-pocket limits. Out-of-pocket limits only apply to when you are in network. So you see, that's why I said in the previous slide, you really need to make sure that you're a bit savvy or that you understand how your plan works so that you don't find yourself with costs that you didn't expect that are, quite a bit higher than you expected. So,
I have a quick question. Sorry, can I
sure,
ask?
sure.
Oh, okay, yeah. So the deductible of 1,500, could that also be part of the limit of 5,000? The
Yes,
pocket limit? Okay.
yes, it is.
So
And
then, mhm.
yes, and so I'm so glad that you brought that up, because I want to mention to you this, that in your open enrollment packet that you should have received from the benefits department, if you recall, there is this side-by-side document that lines up all the plans next to each other. And
Mhm.
it actually, it should have a section on the side where it lists the different service types, and the service types that it lists, just so you know, those are the most common services. They do not express all of the services available to you through your plan, but it does have deductible. It does have a part on there for deductible, and it should say that, I'm sorry, out of pocket limit, and it should say that things that are included in the out of pocket limit are things like your deductibles and your co-insurances. And it's almost like the out-of-pocket limit is like a big cup, and when you pay your deductible, that goes in there. When you pay your co-insurance, that goes in there. And these things start adding up, and when the cut hits that, in this example, $5,000, your cup is full, that is the limit of what you are going to pay.
Okay. Let me ask you this too. So for us, you said it's a 90-10 split, and the
Oh, yes.
out-of-pocket limit for PUSD, is it also 5,000 or is it
No,
a
no,
different?
no. Actually, in an effort to not come off of this screen because I have it here. So for PUSD, it is a $500 deductible for individual, and then if you're a family, it's $1,000, and then the limit, the out-of-pocket maximum, it is 1,000 for individuals and 3,000 for family.
Oh, that's really a good, yeah, that's really
Yeah,
generous, I'm
yeah.
assuming. Wow. Okay.
Yes, it is, but just know also that PPOs, again, take a look at like the premiums so you can see that, if it really is a good deal for you, because it could be, in your mind's eye, based off of your abilities financially, to be able to afford a PPO. Some people it isn't, and for some people it is. So it's really subjective.
Oh, I
So
see what you're saying. So the
yeah,
premium for one person is, do you know what that is? Uh,
off the top of
for,
my,
yeah, for a PPO off the top of your head.
I want to say it's close to 1,000.
Okay, that's not too bad. I
Yeah.
think the HMO Kaiser is 890 something, or is it 900? I don't remember
You know
now,
what?
but
There are 7 plans, so I don't. I would
okay.
be lying if I said I remembered all of. What I'm going to say
Okay.
is, don't take
But
my word as golden with
yeah,
that.
I
Just
can
look at
check.
the open enrollment packet. That's actually going to be the
Yeah,
best
yeah.
thing to go with.
Okay, but
Yeah.
roughly for a single person, PPO is roughly about 1,000, you said, right?
I think so, but
Okay,
again,
yeah, but I'll
check
check.
that packet. Yeah, check that packet. Yeah, check.
Yeah, and last question is about the you kept emphasizing the making sure we stay in network, right? So then how would we select our in network provider? Do you give a list of these in network providers?
No, I don't give a list. However, you can do several things. Number one, you can contact your actual health insurance provider, Anthem Blue Cross, and they can actually provide you a list of providers, and you will want to give them specific information. Like, do you want your provider to be in your area? You can give them a zip code, or if you have a specific provider that someone, maybe a friend, has been raving about, you can call and say, "Hey, is this doctor in my network?" And to be quite honest with you, Anthem Blue Cross has a very big network. So the chances of a doctor you selecting not being in the network is probably pretty slim. So it will likely be in your network.
I was gonna say, I used to have a PPO. I have an HM, well, last year. What I find with the PPO, yeah, you have the flexibility, but then again, you also have to, depending, I guess, on the network or the provider, you may have to go all over the place for things like specialists and getting the blood drawn
Yeah.
and getting the
So
x-rays and this and
yes,
that.
yes,
It's not only one area or one place, right?
yes, you're absolutely right. And in fact, I'm very glad that you brought that up. Sometimes you may have a provider who is in network, but if they order labs and that lab happens to not be in network, you could end up unknowingly go to that lab, get your lab work done because, hey, your doctor referred you to this lab. But if that lab's not in network, you can end up with them sending you a bill in the mail. And
Wow. So it means, so it sounds like you have to stay on top of
yeah,
this PPU, you have to be asking, right? Can you
yes,
pre-approve? Can you make sure? Can you did it
yeah.
before? Because
So
they're not focused on that, right? It
no,
sounds
they're
like these
not.
providers,
They're
they're
not,
just
because they're
sending
not
you
going to
wherever.
deny it. Because you have the right to all of these providers, so they're not going to deny it. So that's why it will be important for you to be doing the work to know what's in network and what's not. Now, if you don't care, that's one thing. But most of us care because we
Yeah,
don't
right.
want unexpected costs. So,
Hmm.
but they're not going to tell you no because it's not an HMO. Because if it's an HMO and it's not in network because it's heavily regulated, they're going to say, no, you can't go to that. And in fact, with an HMO, they will never refer you to a provider that is not in network. So that is kind of the
Right.
dilemma sometimes with a PPO. And I mean, it could be a dilemma for some, but it could be, a benefit for others. And it really is just a matter of what's important to you and what you have the ability to pay for and what your expectations are. But yes, in answer to your question, you do really need to be on it. One of the things that I always say is like if you have lab work or you have something that is being ordered from your doctor outside, that is beyond your doctor's office, is, for example, if it's lab work, ask the doctor, hey, I don't mind getting this lab work. I'm going to do what I need to do based off of what you're requesting. But can you tell me if this lab is in network? And sometimes they'll say, "Oh, I don't know." But you can always say, "Hey, well, what's the name of the lab?" And if they tell you, whatever the name of the lab is, you can always call your insurance plan and just say, "Hey, I've been ordered lab work at this lab. Can you just check and make sure it's going to be in or out of network?" And if you really want to stick with the lab that your doctor's office tells you to, you can call your plan and just say, "Hey, what's my out of pocket going to be for this?"
Oh, I see.
So
Right,
you
right,
just
right, right.
have all this flexibility. The thing with a PPO is you just need to know how to use it. And
Right,
that is the
exactly.
challenge. That is the challenge for some people because there's so many. I don't know if you're kind of have ever had this experience when sometimes there are too many options, it is a bit confusing and
Yes.
overwhelming.
Yes, I have had that. Except,
Yeah.
yeah, I have. But there,
Yeah.
there are other places. I was thinking, like in Diamond Bar, there used to be when I had a PPO, they were like a network. I'm not
Mhm.
sure what it, but it looked like. I want to say, okay, I'm going to call it a clinic. I'm sure it wasn't that, but everything was in house. So you would
Yeah, so they
doctors
kept
were in house,
everything in-house.
all
Yeah.
the lab was in there, and then if you needed
Mhm.
something beyond
Yeah,
that,
there are
then
some
yeah,
facilities like that. No, there are some facilities like that, but that isn't a requirement to be a part of
right.
the network. That just happened to be that particular facility, which is why a lot of people end up liking to go with Kaiser, which, there are mixed reviews on it. And we'll talk a little bit about it, but there's mixed reviews on Kaiser, but because there is less of options that you have to consider, everything is in-house. If you need to see a specialist, they have them they'll refer you directly. You need pharmacy, it is right there in the Kaiser facility. Like everything is streamlined.
Right.
And
Hmm.
based off of what your health needs are, I think that it could be a very good option. Now, it may not be a very good option based off of someone who may have a more serious health issue and they need the help of a specialist and they need more urgent care. Well, then it might not necessarily be the best option for you. Now, I have had care with a very serious condition with Kaiser, and I've had good experiences, but I've also had bad experiences too. So it really just depends.
Hmm. Yes, yes. And lastly, I just realized something too. How easy is it to go from one, like say, okay, well, I decided that I'm going to go with my PPO this coming year, right? How is it? Could we switch to a different plan, or do we have to stay on our HMO who want, or is there flexibility to go between PPOs and HMOs on any given year?
You can switch each open enrollment period, but only during the open enrollment period. So if you decide this open enrollment period, you want to try PPO, after open enrollment, you are stuck with that PPO until the next open enrollment period, if you're looking to change. So yes,
Okay.
you can
Hmm.
switch back and forth, but only during the open enrollment time. The only time that you can switch from one plan to another and it's outside of open enrollment is if it is a qualifying event. So that a qualifying event could be you have a death of a dependent or a sibling or not sibling, dependent or a spouse, or let's just say there is some issues with address or you have a child. So there's a list of different things that are considered qualifying events, that don't typically happen on a regular basis to most people. So in other words, you're kind of stuck with your plan until the next open enrollment period.
Right. Yeah, I understand that. Does that apply to retirees also?
Yes.
Okay, good to know. Thank
Yep.
you.
No problem. No problem. All right, so let's go ahead and move on to the plan options available to you all, at Pomona Unified School District. So you guys have a lot of HMO options. You have six, in fact, and you actually had a new one that was added as of last year. And then you have one PPO, and that is the one that we've just been talking about, the Anthem Blue Cross PPO that has the 90-10 split, where your deductible for single is 500, for family it's 1,000, and the deductible, the out-of-pocket max is 1,000 for single, and it is 3,000 for family. So for the PPOs, you have options of two different Kaiser Permanente options. One is a $10 copay and one is a $20 copay. The more popular one for your district tends to be this $20 copay plan, just because from a out of paycheck standpoint, this one is oftentimes the most affordable for people, but you choose whatever's best for you. And then you've got several different Anthem Blue Cross HMO options. You've got the Anthem Blue Cross Traditional, which is referring to your full network. So you've got a very large network. So when we're talking about the difference between this traditional and all of these different ones where you see select, select really is referring to the pool of doctors and facilities that you have to choose from. So it is smaller when you see select, and it could be even smaller based off of the group of selects as well. And we'll talk about that in a minute. But whenever we're talking about select or traditional, just know that we're talking about size of network. And size of network refers to the number of doctors and facilities and hospitals that you have access to that are a part of the Anthem Blue Cross network. Okay. So let's talk a little bit about these different Anthem Blue Cross plans, because to be frank with you, the Kaiser plans, the design is going to be the same. Really, the only difference between the Kaiser plans is just going to be the amount of the copay that you pay when you go for your doctor's visits. Okay. But the Anthem Blue Cross plans have a little bit more variability to them. And so let's take a look at that. So last year, when you guys came to the open enrollment, this was side by side was provided, and that may also be in your open enrollment packet. Don't hold me to it. But in the past, what you guys traditionally had was the Anthem Blue Cross Traditional, that is the full network plan, the Premier Select, and the Classic Select. And then added last year was this Value Priority Select. The reason it was added is it was just added as an additional option that may be a little bit more affordable for some people. And so what I did here was, and this is not a full expansive list of all of the differences, but it is the primary differences where when you guys are asking questions or you are utilizing services, these are the areas that tend to come up the most frequently in terms of what the differences are, questions on what the differences are. So starting out with out-of-pocket limit, which was one of the questions that was posed regarding the PPOs, well, let's look at the out-of-pocket limit as it pertains to HMOs. So out-of-pocket limit for the full network is $2,000 for single, $4,000 for family. For the Premier Select, it's $1,500 for single, $3,000 for family, and the Classic Select is $2,000 for single, $4,000 for family, same as the traditional. And then this Priority Select one this is where it distinguishes itself from the other ones. So it has a cheaper price ticket in terms of what you're paying premium, meaning what's deducted from your paycheck just to have this plan. It's going to be cheaper, but throughout the year, your limit is going to be bigger. So that means this is the amount for which you pay out of pocket. And then once you hit this amount, the plan's going to pay everything else 100%. This number is a lot bigger, because you're paying less. So that means you're going to end up having to pay more towards the out of pocket limit. 2,500 for singles, 5,000 for family. Okay, so I know you're going to ask the question, okay, so what's the difference between these two selects? So here's, again, it also boils down to network between Premier Select and Classic Select. This Classic Select plan will have a broader network of providers. Premier Select will have a little bit more of a narrow network. than the Classic Select. And of these 3 selects, this Value Priority Select will have even a more narrow network. So that is, again, the number of doctors, the number of facilities and hospitals that you have access to. That's what we're talking about when we talk about Premier Select, Classic Select, Value Priority Select, and Traditional. These things are going to determine how big or how small. So what that means is if you're searching for a doctor, the list of doctors that you try to get from the provider, from the insurance carrier, may be bigger or smaller based off of one of these plan types. One thing I forgot to mention when you asked the question, when the question was posed about how do I know where to find these doctors? The one thing that I mentioned is that you can call your plan, you can call Anthem Blue Cross and give them information on, hey, I'd like to try to find a primary care doctor in X zip code, or I'd like to see if Dr. Sally Sue is in the network. You can do that. Or you can go online and you can look up the doctors on the Anthem Blue Cross website. A bit of caution on that, though, is that because doctors come in and out of network all the time, they decide they want to stay with Blue Cross. Sometimes they decide they don't. Sometimes they're retiring. Sometimes there's new doctors. Sometimes they've closed the practice. When you look online yourself, sometimes that information can vary. So I always suggest calling Anthem Blue Cross. The other thing is you can ask the doctor's office. The only reason I didn't suggest that first is because doctor's offices sometimes get new staff all the time, and they may not be as well versed in the billing and the health plans. So you may get someone who could potentially give you incorrect information, or not have the answer to your question. And so you might get frustrated. So I always say the first thing to do is call Anthem Blue Cross and find out, whether or not your doctor is in the network. So with that being said, you could have a doctor who is in all of these networks. Okay. So if they're going to be in this Anthem Value Priority Select network, chances are if you're considering between this one and the traditional, they're going to be in this one. Okay. Because this Anthem Value Select is going to be the most narrow of them all. So I hope I didn't confuse anyone with talk about the network, but that really, when you're looking at the differences and you're looking at these plan options and you're like Select, Premier, Classic Select, what's the difference? They're talking about the access to doctors and providers and facilities that fall in that network, okay? So the other thing, go ahead. Sure, go ahead.
I'm just wondering, with Kaiser, it's sometimes very difficult to get an appointment with your same doctor. And I feel like I'm pretty good, well versed with how to, but I'm just wondering, they're just really impacted. Kaiser's very impacted, right? They have so many patients. I'm wondering if this Anthem HMO is similar to Kaiser. You might not be able to, answer the question, but
it's going to vary. Yeah, it's going to vary.
Depending on the provider, right? The in-network, yeah. Okay. Yeah. And too, I missed the, did you say what the deductible limit, let's see, the deductible, no, the out-of-pocket limit for Kaiser was for like a...
Oh, I did not say. So the out-of-pocket limit for Kaiser, there's not a deductible, first of all, because it's a HMO. Kaiser is an HMO. Right. So the actual $10 plan for the out-of-pocket is, I believe it's $1,500 for single and $3,000 for family. As I mentioned before, I'm going to always encourage you to look at that the plan document that's in your open enrollment packet, but off of my scratch pad here, it's $1,500 for single, $3,000 for family.
But it doesn't work.
That's correct.
Right. Okay. But it's not where we have to pay the first $1,500.
No, that is a characteristic of a PPO that what you're describing right now. That does not apply to HMOs.
Got it. Okay, thank you.
And Paul, I saw that you have your hand up.
Yes, thank you. Thank you, Ms. Simpson. going back up to the calendar year out-of-pocket maximum.
Okay,
I'm looking at it. It's just my wife and I. Kids are gone now, so it's just my wife and I. So we're under a family spouse plan, I guess.
okay. You're fine.
And the individual is 500, but the family is 1,000. Is
Mhm.
that 1,000 for both of us or 1,000 for each of us, my wife and I,
I believe that should be 1,000 total.
total? So let's say let's say I have all the problems and I'm at the doctor's all the time
Mhm.
and my wife isn't, as an example.
Yes,
My deductible would be 500 as an individual, or would it be 1,000?
it would be 1,000 because because it's based off of the plan type that you're on.
Okay,
Yeah.
fair enough. But because there's two of us, it says out-of-pocket maximum is 3,000. Would
Mhm.
that not be, in our case, since it's a spouse, a spouse added, that it would be 2,000 altogether?
No, you're talking about two different things.
Okay.
So deductible versus so I'm assuming you're on a PPO plan, correct?
Now, currently we're on HMO, but
Okay,
looking
so let me,
seriously at the PPO. So,
okay, so if you are on an HMO, the deductible piece of things is not even an element. There is not a deductible for an HMO, any of the
right,
HMOs.
right.
Now, if we're talking about a PPO, the the deductible for a PPO is 500 for the individual, 1,000 for the
Family
family.
plan or
Right.
spouse. Okay,
So know that anytime you pay deductible, that goes into the out-of-pocket maximum bucket or cup. It
oh,
fills that
yes,
bucket, right?
yes.
So
Okay, I follow.
okay. So so if your out-of-pocket maximum bucket is 3,000 and you end up paying 1,000 towards your deductible because you're the problem child between you and your wife and you have to have all the care, that just fills up $1,000 of your 3,000 that you guys have to meet in order to hit your maximum.
Perfect, I understand.
Okay,
Great.
perfect. All right.
Further down on the list, if I may,
Mhm.
I'm looking at the 2024-25 medical options and all the services. On the second column down, professional services, it says right at the bottom, it says zero deductible waived for preventive care
Oh, that's
services.
actually a good point that you mentioned. I'm so glad you brought that up, because that is something that I did not put in this presentation. Preventive care services. They are required by the Affordable Care Act that whether we are talking about an HMO or a PPO, preventative care services are required to be provided to all plan members free of charge. Preventative care services, the types of services can be found on any one of your plan websites. But just to give context to what they are, a lot of times they're your yearly physicals. If you are pregnant, there's the well mother or I think they call it well mother exams, and they are basic services that are provided in the initial care for a woman who is pregnant. There are also certain types of exams like breast cancer, colon examinations. Like there are certain services that are to be provided to you, whether it's an HMO or PPO, free of charge. And they put that on there because if it is a service that is like, say you have to go back for another examination of the same nature, if you go back the second time, you may be charged for it. But that first one, if it's labeled as preventative care, you will not be charged for
Thank
it.
you.
Okay, perfect.
That makes sense.
Okay,
Okay. Thanks, Ms. Simpson.
no problem, no problem. Did I answer all your questions or were there?
So far, we'll see.
Okay, perfect. Okay, so thank you for bearing with me with my very clumsy explanation around preventative care. And I'll make sure I include that in next year's presentation because that is a very important point to point out to people. So in terms of this difference, the other difference you'll see with the Anthem Value Priority Select on this HMO comparison, is the copays are a bit different. And the copays do vary a bit from plan to plan. But the reason that you see these all highlighted in yellow is because they are more expensive out of pocket throughout the year for these copays that you have with this value priority select. And I mentioned that because the copays and expenses throughout the year are more expensive, but it does have a smaller price ticket on the premium that you pay out of your paycheck just to have that plan. Okay. So I just want to make sure that's clear. Not necessarily telling you you should not get this plan, but it may not be the best option available to you. But I also understand on the other side of things is that sometimes, having some type of coverage may be better than not being able to get, anything at all. So, but I do want you to understand what that's going to mean throughout the year from a cost standpoint. Okay. All right, so we've kind of been talking about this a little bit throughout the time that we've been discussing. And I always get the question when I'm talking to people, which plan is the best plan for you? And really, it really varies on a lot of different factors. It varies on, is the plan going to be covering just you, or is it going to be covering yourself and kids, or is it going to be you and a spouse? Very different needs, honestly speaking, because the answer will be different for just a two-party, you and your spouse, as opposed to you and your child. Because children have different needs, and at certain points in times in our lives, we may or may not need to frequent the doctor's office. So we may or may not want to be choosing a plan that is going to be a bit more comprehensive. The other thing is going to be, what is your health situation? Are you experiencing a major health issue that requires access to specialists and timely access to specialists? If so, a PPO may be a better option for you. If not, if cost is really a big thing for you and you're in relatively good health, you may want to consider, at least for the time being, doing an HMO. And the thing about all of this, it is all very subjective, and at any moment in time, your health situation can change. So it may be one thing for you this year, but then come open enrollment next year, you may have to switch up your plan. So when it comes to this, I'm happy to talk to you and run some things by you to consider. If you would like to talk to me one-on-one, I'm happy to do that. I have done that with your employees just to help you consider some things around choosing one plan or another. I will not make a plan choice for you, but I will make sure that I discuss with you things that you should definitely consider when deciding whether or not a plan change is going to be in order for you. Real quick, before I move on to the very tail end of this, because we're coming up on the 5 o'clock hour, is pharmacy benefit managers. And basically, what is a pharmacy benefit manager, a PBM? A PBM is like that middleman that essentially is between your insurance company, the drug makers, and the pharmacy. And they manage all of the dynamics between all three. And they help to keep costs at bay, really, for your benefit. I know that sometimes you may be a bit frustrated when there are certain drugs that are denied and are not covered, but they're also managing drugs that come on and off of formulary. They are managing that because the changes from the drug makers and the cost of those drugs, all of these things are all fluctuations. So a PBM, a pharmacy benefit manager, is often necessary. Well, what is a pharmacy benefit manager? Well, in your case, Navitus is the pharmacy benefit manager, and they manage the pharmacy benefits for all of the Anthem plans. Kaiser is it's all contained. So Kaiser is its own pharmacy benefit manager. So just know that.